Hello, I'm Amit Tata. This is joint work with my colleagues Nirup Menon and Sid Das in the Costello College of Business at George Mason University. Telehealth or telemedicine refers to the use of digital technologies to provide healthcare services remotely. This virtual healing ecosystem can help lower healthcare costs, improve patient outcomes, and increase the efficiency of healthcare delivery. The broad goal of our project is to study the relationship between telehealth or telemedicine adoption by hospitals and its impact on different hospital performance outcomes. Let's move now to the specific research problem that is the focus of this treatment. First, the what and the why. For our initial investigation, we selected Medicare payments for acute myocardial infarction, AMI, as the performance outcome. This is motivated by the fact that cardiac disease is the leading cause of death in the USA, and the American Heart Association projects that by 2035 there will be 24 million Americans with coronary heart disease. Cardiovascular disease wreaks havoc on the economy, with a price tag estimated to exceed $1 trillion by 2035. Medicare spending accounts for 20% of all US health expenditures, and the US Centers for Medicare and Medicaid Services, CMS, is mindful of the costs of providing care to the more than 55 million US citizens covered by Medicare. CMS pays approximately $11.7 billion annually for in-hospital costs for Medicare beneficiaries with coronary heart disease. We have curated data from 2017 through 2021 by identifying specific questions from the American Hospital Association annual surveys and the AHA IT supplement surveys. These selected survey questions are aggregated to create model variables reflecting telehealth or telemedicine services, cardiac and non-cardiac medical capabilities, medical personnel, and number of beds for individual hospitals. The CMS Hospital Compare Archives contains Medicare payment information for each hospital, both in absolute dollar terms and in categorical forms, the latter specifying whether the payment to a hospital was less than, no different from, or greater than the national average payment. We use this categorical payment data for us. We hypothesized three relationships associating telehealth services with Medicare AMI payments and test them using a collection of logistic regression models. The first two hypotheses relate increased use of telehealth services with the likelihood of lower than or greater than average Medicare payments, respectively. The third hypothesis relates the increased use of telehealth services to the likelihood of being in the lower than average category compared to that of being in the higher than average category of payments. We find empirical support for the first and third hypotheses, and these are shown in blue on the slide. Collectively, these findings offer empirical support to conclude that adoption of telehealth services by hospitals is indeed associated with an increased likelihood of lower Medicare payments for AMI specifically. Plans for further analysis will be discussed in conclusion.